This is what the eye looks like from front to back. So this is the cornea, which is the glass of the eye. In comparison, you can compare it with, the glass that you see in your watch. So it's the front of the eye through which light passes. Here is the lens, here is the retina, and here is the optic nerve. These are the important structures. So any disorder, any disease which affects this front of the eye, this glass of the eye, is a corneal disorder or a disease. Corneal diseases can be infections, which are quite common. These infections can be either fungal, can be viral, can be bacterial, and others also. These result generally in the formation of a scar, which requires a transplant in the future. We also have a disorder known as keratoconus, which is quite common but underdiagnosed, where this cornea, instead of having a shape like this, it becomes conical in shape. So this is what happens in keratoconus. It is secondary to allergic disorders and eye rubbing, and generally starts in the teenage groups. Apart from that, you have some degenerations and dystrophies which are congenital. You can also have scars or opacities which form after any injury or trauma to the eye. There are lots and lots of causes, and the cornea is the door to the eye, so it is the first one to take the insult. Multiple causes, as I said. The infections can be either bacterial, viral, which is herpes simplex and zoster, and you have fungal infections, you have protozoal infections as well, and etc. etc. In India, if you say fungal keratitis or fungal corneal ulcers are the most common. In North India, generally it is aspergillus, and in South India it is fusarium species, but others are also seen. If you go to ulcers, generally they have a painful red eye with along with watering. There's decreased vision. It's kind of like an emergency. Even more when it perforates, या जब वो फट जाती है, if it's not treated properly or on time. Keratoconus is a very slow disorder. It causes decreased vision over a very long period of time, over about 10 years, 5 to 10 years or something. So they can have associated itching feeling of the eye, and the vision is kind of like distorted. Particularly when you look at light, it has the phela phela, like a starry pattern. These are because of high order aberrations which are caused by it. Opacities will cause a decrease in vision, or again these high order aberrations, and similar with other disorders. So since light cornea enters through this, anything which is involving this will definitely affect your vision. Mostly corneal disorders are treatable, particularly when you have in time. The good thing is that you can do a corneal transplant and cure that corneal disease for good. The time it becomes untreatable is when secondary to it or related to it, you have damage to the retina or the optic nerve, particularly when the infection spreads backwards inside the eye. So that is when it sometimes becomes irreversible, but otherwise, a corneal disease is a preventable and a treatable disorder or disease. Firstly, it is clinical evaluation. So, for ulcers, microbiology analysis, when you scrape it and send it to the lab for evaluation, that helps. For certain disorders like keratoconus, a corneal topography or a tomography test really helps, along with evaluating the epithelium of the cornea in dry eyes as well. You also, aberrometry is another scan that helps to know. Sometimes the vision is good, 6 by 6 or 20 by 20, but the patient is not comfortable. So you get to know about these higher order aberrations. Why is the patient not comfortable after having a good vision? So aberrometry helps. Apart from that, there's a test known as specular microscopy. So this helps to evaluate the inner part of the cornea, the inner surface right here inside. So the inner surface has got endothelial cells. They help to evaluate whether they are problematic. If they are problematic in congenital disorders or in acquired disorders, then we do an endothelial keratoplasty or transplant and cure it. As I said, cornea is a vast subject. For infections, you have to treat medically with either drops or sometimes oral medication or ointments. If it gets out of control, or if it's not being managed, the drug, the disease is, or the organism is resistant to the drug, then you sometimes have to give injections inside the eye, or you have to do a transplant early on to save the eye. For vision purposes, for an opacity, or you have to do a corneal transplant, which can be either full thickness or partial thickness. The transplants nowadays are very, very good. The success rates are excellent. And the thing is, it is more of a targeted approach where the disease layer can just be replaced and treated with. Now, uh, apart from that, in keratoconus, contact lenses, specialized contact lenses, these are not lenses that you get at everyday shops. They can help to improve the visual acuity as well. Contact lenses are a risk factor for a lot of disorders. So if you have dry eyes, you should never use contact lenses. If you have allergic disorders, which can happen because of contact lenses, so you need to be very careful. A very important point when using contact lenses is that you should wash your hands before applying them. The solution should be clear. And if something happens in the eye, if you're a contact lens user, redness or pain or something, take them out immediately. Don't throw them away. Take them to your eye doctor. They will send those contact lenses in solution for an evaluation, because if an infection happens after a contact lens use, it is very bad. So it requires immediate and urgent attention. Any kind of injury, if you have a work occupation where there's a risk of trauma or injury, you should wear protective glasses. And have repeated eye checkups. Sometimes, in the earlier part of the disease, it is difficult to diagnose unless you have visited an eye specialist or a cornea specialist. And sometimes investigations are the only way by which you can diagnose some early disorders like keratoconus. Timely checkup and protective glasses is all I would say. Do not treat yourself. That is extremely important. A lot of problems of cornea are related to over the counter medications that are available from medical shops or pharmacies. They give you steroids. So, steroids, we write a lot of steroids, it's not that. But these over the counter medications actually makes the disease a lot worse than, or worser than it could have been if you would have presented to the doctor first.